Imagine a world where fighting climate change also directly makes us healthier and maybe even helps pay for our health care. Sounds ambitious, right?
Yeah, it does, yeah.
Well, today we're taking a deep dive into this fascinating world of co-financing for health and climate goals.
hmm
Our mission really is to unpack how funding streams are, or maybe how they could be, synergized to tackle both crises.
hmm
Moving us towards a truly smarter way to invest in our future.
Yeah.
So let's explore this.
Okay. Well, what's often overlooked, I think, is that climate change and its related hazards are already costing us a lot. In terms of health,
Right.
we're talking significant impacts on government health budgets, insurance premiums, even what individual households end up paying.
So it's hitting us everywhere.
Exactly. And this is often like passive co-financing in action. We're essentially just paying for the consequences of, well, doing nothing or not enough.
Can you give an example?
Sure. Think about the surge in hospital visits because air pollution is getting worse, or the out-of-pocket expenses families face after climate disasters like floods or, extreme heat waves. We're constantly reacting to problems we maybe could have prevented.
That really drives home the hidden costs, doesn't it? The cost of inaction.
Absolutely.
And it's precisely because of these sort of passive outflows that this concept of co-financing becomes so, well, crucial.
hmm
The research we're diving into today proposes two main categories. You just touched on passive, which is like, I don't know, unknowingly draining your heating budget because you've got a leaky roof.
Right, exactly. You're paying, but not strategically.
Exactly. But here's where it gets really interesting. Strategic co-financing. This means proactively budgeting and planning investments. The idea is to reduce risks and build resilience across both health and climate.
Okay.
It's like investing in that new roof before it leaks, saving money and, improving comfort down the line.
Yeah.
It's a fundamental shift, isn't it? From burden to opportunity.
It really is. And on the strategic side, we have seen some pretty innovative examples where health financing is explicitly used for climate adaptation.
Oh, interesting. Like what?
Well, the US CDC, that's the Centers for Disease Control and Prevention through its BRACE initiative, for instance, they actually funded local health departments to develop specific climate vulnerability assessments and health adaptation plans.
So using health money for climate resilience directly.
Precisely. Now, the enablers were things like earmarked funding, dedicated staff, but barriers definitely emerged too, things like coordination challenges, skill gaps,
Yeah, I imagine.
especially for, say, rural health departments that maybe struggle to compete for those funds. Equity concerns popped up there. And what's fascinating is how this can also work in reverse. In Bangladesh, they have a national climate change trust fund that directly earmarks health sector funding for climate goals.
Okay, so it goes both ways.
hmm
And it's not just these big government programs, is it? You mentioned the passive costs hitting households.
That's right. The ripple effects hit us directly. Take China, for example. Escalating air pollution there is, perhaps unsurprisingly, driving up demand for private health insurance.
So people trying to protect themselves.
Exactly. But while it shows individuals trying to adapt, it also raises pretty significant equity concerns, right? Because wealthier households are just more likely to be able to afford and get that coverage, leaving others vulnerable.
Yeah, that makes sense.
Yeah.
It's a clear instance of how, uncoordinated passive financing can actually make inequalities worse instead of building resilience for everyone.
Conversely, climate finance itself can be a direct source for health funding.
How does that work?
Well, take carbon pricing. Putting a cost on carbon emissions through taxes or trading schemes, this generates substantial revenue.
Right.
Switzerland, for instance, very successfully used funds generated through its carbon tax to actually alleviate healthcare insurance premiums for its citizens.
Wow, okay. So climate action paying for healthcare costs.
Directly. And it wasn't just a clever financial maneuver, it's kind of a powerful blueprint, showing how climate action can directly improve people's daily lives, putting money back into their pockets for essential healthcare.
And you mentioned it can even make the taxes more popular.
Potentially, yeah. Earmarking these taxes specifically for health can increase their social acceptability, which raises an important question. Why isn't this happening more often?
Good question. What are the barriers?
Well, a key one seems to be the limited number of health institutions actually accredited to apply for these big climate funds. Plus, often just a general lack of engagement between the health folks and the climate folks.
Silos again.
Pretty much.
So the review also points out something called integrative co-financing, where multiple sectors actually pool funds for joint goals. but it says this is largely unexplored.
That's right. There are very few real-world empirical examples, which probably reflects just how complex these ventures are.
But there must be some hints of it.
There are. Consider Ghana's AAP 1000 program. This was a conditional cash transfer program targeting vulnerable families, and it was strategically paired with a national health insurance scheme.
Okay.
And that led to significantly increased enrollment and access to care for those groups. So a joint effort yielding results.
Interesting. Any others?
Well, you could look at the EU Solidarity Fund. Initially, it was for disaster relief, but it was extended to cover health emergencies after COVID-19.
Adapting existing funds.
Exactly. So if we connect this to the bigger picture,
Right.
these models, while, yes, incredibly complex to implement, you've got governance issues, shared metrics challenges they represent, perhaps the ultimate vision, truly synergistic cross-sectoral funding.
Right. That seems like the goal.
Ultimately, I think the evidence really highlights a critical need. We have to move beyond simply paying for the endless consequences of climate change. We need more strategic, more forward-looking co-financing arrangements, ones that actively bridge the gap between the health sector and the climate sector.
So summing it up, this means more cross-sectoral collaboration, right?
Definitely.
More dedicated funding streams that aren't just stuck in their own silos. And critically, building the skills, the capacity to integrate health into climate plans and vice versa.
Absolutely key.
And for you, the listener, it's really about understanding that our choices, the choices we make about how we finance health and climate today, will profoundly determine our collective resilience tomorrow. It's not just about spending more money. It's about truly spending smarter, finding those double dividends that benefit everyone.